The Nigeria Governors Forum has advocated increased funding from 1% to 3% of basic healthcare provision to achieve universal health coverage. Alhaji Aminu Tambuwal, Chairman, Nigeria Governors Forum, made the call at a high-level forum on Sustainable Development Goals panel discussion on the universal coverage and the Basic Health Fund. Speaking on the proposed state contributory funding for health, Tambuwal assured that the issue would be presented at the next Economic Council meeting for deliberation and possible outcomes.
Well, on the funding, we have just advocated at this interactive session that since the Basic Health Provision Fund Act says at least 1% of the Consolidated Revenue Fund should be allocated annually, we can rely on that provision which says at least and increase it to maybe 2%, 3%. That is, of course, another solution to the constraint of funding. And then the private sector participation in funding and our own partners that are supporting us in healthcare should also possibly give some funding to the project that we're carrying out in all of our states. And then, of course, insecurity is a collective effort. The federal government and with the states are doing their best to ensure that we stem the tide. So it's an ongoing effort. And the last one, human resource. We have to work hard to improve on the packages and welfare of our medical personnel, both the federal government and the state governments, for us to really arrest the challenge and problem of brain drain in Nigeria.
For her part, the Minister of Finance, Budget and National Planning, Hajia Zainab Ahmed, said a framework had been designed to monitor and ensure accountability in the disbursement and utilization of the fund.
To insulate the Basic Healthcare Provision Fund, we made a provision to put them on first-line charge. So which means consistently 1% accrues from the Federation account to that fund. And of course, we want to make sure that what is provided is used and is used properly. So we have committed to ensuring increased funding for the health sector, not only for the fund, but for the health sector more broadly. In the 2023 budget, the total aggregate provision for health is 8%.
The Director and Secretary, Ministerial Oversight Committee of the Basic Fund, stressed the need to block leakages and institutionalize accountability.
There are at least 86 million Nigerians, some say it's about 100 million Nigerians, and for each of our beneficiaries, we pay 12,000 naira per annum for now. So if we have to get 86 million people on board at 12 million, that's approximately 1 trillion naira, including cost of operations and all of that. And that is per annum, because the premium we pay for each of our beneficiaries is for 1 year. And so every year we have to pay for those beneficiaries until they are taken out of poverty. We must not forget that the whole essence of this is to reduce out-of-pocket expenses for Nigerians.